We know that at this time there remains a very low public risk to New Hampshire when it comes to COVID-19. We know that there's no evidence to suggest that there's any widespread community transmission. But that being said, as state officials, we must make tough decisions that are truly in the best interest of the 1.35 million people that we represent. So while that current risk remains low, we're taking the preventative steps today to ensure that all the state resources are at the ready and available to respond and to deploy in a moment's notice. Therefore, under New Hampshire state law and the New Hampshire Constitution, I am signing an executive order declaring a state of emergency in New Hampshire. Under our state law, declaring a state of emergency confers significant and broad powers to the governor to be used to protect the people of this state. It's not an action that I take lightly, and we have taken the time to thoroughly assess all of the different options before taking this extraordinary step. This declaration will allow the state to remain on top of the situation. Today's decision and subsequent actions are not the full range of acts that the state may ultimately take. It's imperative that residents remain calm. They work together to support each other as the situation evolves and changes. The one thing that we know is that we can count on is truly that spirit of community. We all share and look after our neighbors in our times of need, and we have to keep that spirit moving forward. To respond to some of the more key questions out there, we are not closing public schools, but we are taking the necessary steps to allow remote learning opportunities, which I think will give school districts flexibility and again, responding as they see fit to this outbreak. When it comes to testing for the coronavirus, one of the number one questions we are asked are who can receive the test, when and why. As more tests have become available into the private market, healthcare providers in New Hampshire now have the opportunity to test individuals as they see fit, and individuals can make those requests through their providers. The risk to New Hampshire remains very low. We just want to make sure that we are nimble and we can act quickly and as rapidly as the situation may evolve rapidly. We've seen that happen in other states. We want to be prepared. The vast majority of the most intense cases that we have tested, over 90% of the folks the state has tested, have come back negative. But we do have 6 cases out there, and we do appreciate that the situation could evolve very, very rapidly given the high contagion level of the COVID-19 virus.